We're going to start with our lunchtime, we'll call it entertainment. This is Tim Best. We're going to be starting and talking about the healthy lifestyles and the SHAPE program. And so I'll have him explain a little bit more about that. Go for it. Thank you.
Thank you so much. I'd like to thank Dr. Moore and Dr. Lloyd for having me here today. Currently, my position is the Healthy Lifestyles Director of Davis School District. I understand we have some people here from out of state and out of country. So Davis School District is the county just south of Weber District, which is Weber County, which is where we are here today. And our school district has 90 schools in it, about 75,000 students. We have over 10,000 employees. So that kind of paints a picture of the size and scope of our school district. In our department, we oversee employee wellness, K-12, health and PE, driver education, which is one of the best things I do during the week is, instruct our adolescent teens to get behind the wheel of a 2-ton automobile. Secondary athletics, which is also another fun part of my job, and then Title IX compliance for athletics. So those things keep us quite busy, but the reason I'm here today is and a past president of SHAPE Utah, which is our Society of Health and Physical Education teachers and partners throughout the state and the health department and whatnot. That's our organization, that's statewide, and we focus on mostly professional development for those that are involved in that organization. But I remember years and years ago, I would go to a conference and a physician would put up a slide and they would show how the increasing rates of obesity amongst our adolescents, and it would just increase every year. I'd go back and see another slide and, hey, our kids are getting slightly bigger, and then I'd go back the next year, and guess what? Our kids are still increasing the size of their waistband and their overall weights. And instead of pointing fingers and saying, why aren't we doing something about this in our schools? I just figured, well, I'm going to try and do something about this in our schools. So we created the Healthy Body, Healthy Mind program in Davis School District, and we put this in 62 of our elementary schools to some extent. The first couple of years, we start small and scale fast, so we started in 2 elementary schools. It was a little process working with our assistant superintendents over curriculum, telling them, hey, guess what, I want to take 10% of their teaching time and replace it with movement, and then see what happens to their assessment scores. And, this is my 30th year in education, so she knew that, I usually don't fail at what I try to do, so she reluctantly said, we'll give it a shot. And then we reached out to the principals of these 2 schools, went to their grade level chair, and then finally the faculty told them what the plan was, and this is the Cliff Notes version of the Cliff Notes version, and just said, we're going to take some of your teaching time, but we're going to replace it with movement, because my hypothesis is, based on some research and data, that it won't affect student learning, your outcomes. Your summative assessments will be just fine. And the other thing was, which was a little scary, was we're going to hold the teachers harmless with what happens to the assessment scores, and it all falls upon me. So I was confident and willing to take on that risk. So it was a couple things kind of sparked interest. This is the Chuck Hillman slide, University of Illinois, where he took a functional MRI of the brain with 20 minutes of sitting quietly, and you can see the brain on the right is 20 minutes, after a 20-minute walk. And so a little bit of data to my teachers that were involved in the program, saying on the right is good, on the left is what we're seeing in the classrooms right now. And so the analogy I said was, okay, if I wake you guys up at 3 in the morning and said, let's take a math test, first thing you'd probably call the cops because you don't know me that well. But if you didn't, you would say, and I understand a lot of you went through med school and you were, maybe you were already up at 3 in the morning taking tests. My brother's an ER doctor in Kansas City, so I'm well aware of those late night studying things. But if I gave you that test, you would think, this isn't a good time. I'm sleepy, I'm lethargic, the blood's pooled in my, we always say if the bum is numb, the brain is the same. Okay, so if the kids are sitting on their tail ends for 7 hours a day, and we're telling them, okay, Tim, pay attention. Well, I was that ADHD kid when I was, in grade school. Now I'm just an ADHD adult, but, I would tell my teachers, I'm trying, but it's necessary, not naughty, for me to move. Like, you have to give me an outlet. Otherwise, I'm that kid that you're keeping in during recess all year long. And, we've changed the policy in Davis District that you do not withhold recess for punishment, for reward purposes, or to complete homework. If it's an issue at recess, yeah, thank you. If it's an issue at recess, you can keep them in for recess. Otherwise, they're going outside because they need to move. They need that break. But if I gave you 5 minutes to get up, move around, you're going to have a better chance of having a better assessment at 3 in the morning than if I just woke you up and said, here's your math test. So Dr. Rady is a clinical psychologist at Harvard. He's a medical doctor. He wrote a book called Spark, and we took Spark in one of our schools and gave it we named it Strenuous Physical Activity Results and Knowledge. And so we got the teachers pumped up. I gave them all the information. Here's the best part about this program. It's absolutely 100% free. It does not cost one dime. Okay, now we could get a good workout in here with the equipment that's in here. Obviously, we could get a better workout if we went to the fitness center where there's some workout equipment and whatnot. But you don't need equipment to do this program. And the last thing I wanted to do is give the teachers one more thing and just say, here's the program. It's great. I'll see you at the end of May. Let me know how it goes. So I was in there. We trained the teachers. I had a 6th grade teacher that walked in with their arms folded. We were going to do some activities that involve, you take an academic lesson and just think, how can I infuse physical activity into that? You're already going to teach the lesson. How can I put physical activity within that lesson so the kids are moving? Talked about kinesthetic learning. And what Dr. Rady does, he gives some of his patients, instead of giving them a pill, he gives them a dose prescription for exercise, especially his attention deficit patients. He says, you're going to take 30 minutes of exercise and follow that with a good, healthy meal, rather than, here's a pill. Obviously, some kids are, they really need that medicine, but give these kids an opportunity to get up and get moving. So we talked about the costs, and the duration was, what happens with their schools is every morning at the first bell, they have 15 minutes of physical activity outside or inside, depending on inclement weather. So instead of going right into math, we took them outside, and they had different activities that I provided for them and trained them on, and the kids were moving for 15 minutes. I went to the back to school night and told the parents, hey, you're not dropping your kids off, and hey, the first thing in the morning they go to recess. Like, When are they going to learn? Told them about the program, and unlike a lot of the things in my department as the director of healthy lifestyles, the only complaints I had from parents were, what took you so long? And some of them were not kidding. Like, why haven't you done this years earlier? I throughout that whole program with how it expanded, I never had one parent say, how dare you make my kids healthier? Not one, and it was great. So they loved it. They kind of knew the methodology behind our program, and we were off and running. And that sixth grade teacher, she came in with her arms folded and said, this better be good. This better not be another waste of my time, another district program. And so we didn't want to mess up the data, but she was a sixth grade student at the end of the school year in May, and we said, you can do it with your outgoing sixth grade teacher or students. She came back 2 weeks later and said, this is great. She became my poster teacher for how good the program was. She said, I thought the kids would have a hard time exercising coming in. They're going to be sweaty and smelly, and they're going to be off task, and they're going to be just hyped up and whatnot. And I said, well, don't focus. That's part of your procedures in your classroom. I can't really help about the sweaty and the smells, but that's in our health curriculum. But she loved it. And she said, believe it or not, I do it with the kids, which is what we encouraged. We had custodians out there, our lunch, our front office staff, anybody in that school at 8:30 in the morning, you're outside exercising with the kids. And then they come in, they sit right back down, and we told them, you don't want to use getting that blood in the brain's two hemispheres. You don't want to use that great opportunity to go right into silent sustained reading. We want them to go into their most difficult subjects. One of the things, and the previous speaker, I think I understood like 5% of the words he was saying. I know you guys are like, it makes sense, but I'm not going to delve too much into my world with PCBL and personalized competency-based learning, but this slide is basically giving kids option, and I love Calvin and Hobbes. I was Calvin when I was a kid. The kid that sneaks out of the window went down. This kind of dates me, but I would find a payphone and call my mom at 2 in the morning and say, hey, Mom, guess where I am? I was that kid, but just like Calvin. But we want kids to control their learning, the pace, place, choice, voice, how they learn. And so we put, exercise balls in there. If the kids wanted to sit on an exercise ball instead of a hard, fixed chair that's basically like sitting on a concrete cinder block for 7 hours. I mean, and that's true. You look at any classroom around the country, look at the teacher's chair. Comfy. It relaxes. It goes back 130 degrees. It's cushioned. And then you look at the chairs that the kid's on, and ugh. Okay, so we gave them a choice. We even have desks. We designed 3 schools after this program that are built around movement. They have entire wings, probably about the size of this. Their classroom door is a garage door. It's a clear garage door, which our safety and security guys not happy about. But the door rolls up, and then they have these big pods where kids come out here. We can put 300 kids in that common area, and then they can exercise inside. So, we have desks and chairs that rise. So if the kid wants to stand up while they're learning, we let them, as long as it doesn't create a problem for them or somebody else. When I talk to teachers about BDNF, I'm just so happy because I don't have to explain that to y'all. You guys know what BDNF is, but my teachers are like, brain what? So I had to explain, just think miracle grow for the brain. Okay, so that's what exercise releases at BDNF. And I tell them, you kids are always paying attention to something. Most of the time, it may not be you. Okay, so they need that break. Let's get them up. Let's get them moving. and then let's teach them. Here is one sample exercise. Hope that's big enough, but I tied them into our state core. So this is, my part with helping the teachers teach what their current lesson plans. I just added movement into it. So this is a fourth grade. The objective is fourth grade from safety and disease prevention. And then they'd run around and talk about how they can get rid of cholesterol and reduce plaque and things of that nature. Okay. And then I just got a couple more. This is just a fitness chart that I sent home with the parents. And so it's May 19th, and this is old, but they just read that date, and then there's their exercise. Okay, so I did that for the entire year. So it was all mapped out for the teachers. And then finally, here's just an example of the daily classroom movement ideas. And it looks like I'm out of time, so I can share this with anybody, but let me just say finally that our control schools blew the lid off their assessment scores compared to the pilot blew the lid off the control schools in both of those schools. So I took 10% of their learning away, and they increased. One of our schools, Parkside, had the best proficiency gain and growth in the state as a title school, which is our lower SES, socioeconomic school, the top school in the state of Utah. And I took away 10% of their teaching time and replaced it with movement. Okay. I could talk all day on this. It's just wonderful.